Dementia kills, and that's not universally understood by people.
People who care for people find it difficult to accept that this is what is going to happen.
It is a terminal illness. You sometimes die purely of dementia, poor nutrition and just becoming weaker and weaker, although the final mode of dying is often something like a pneumonia or a heart attack.
Dementia is actually a collection of symptoms. It's a syndrome rather than a single disease. At the end of life, people will have a range of different problems, and the services that need to respond to that don't always come together terribly well.
After a certain length of time, the disease process will take over the brain in such a way that cognition is impaired. So you won't be able to make those same decisions anymore about what you want for yourself towards the end of your life.
There are a lot of elderly people with dementia living on their own, and particularly in central London, a lot of people don't have family support because they don't live in the area. Often it's taken for granted people will go into a nursing home, but it may be that their wish was to stay in their own home with support.
People who are distressed in dementia can suffer very badly, and we have to manage and reduce distress. It's a really important concept. We've discovered a lot about friendship and support, of having a nurse just like a Macmillan nurse would for cancer. Ongoing support, ongoing care.
My name is Morejoy Saineti. I'm a Dementia Voice Nurse working for Housing 21 in Westminster. The role of the Dementia Voice Nurse is identifying the person who is dying with dementia and assessing their needs and supporting them in terms of advocating for care packages, training families to cope with the issues of end-of-life care.
People with dementia and their families very much appreciate the role. They recognise the improvement that the nurse has been able to achieve by getting the different parts of the system to work together.
If the Dementia Voice Nurse is going to be established, she should be coordinating services. So she must be understanding the end-of-life care plans for individual people.
When you're living with somebody with dementia, you worry that you're doing harm, and by having that reassurance from the nurse, it's given people an awful lot of confidence. The other thing that's given them is that knowledge that at the end of the phone line there is a Housing 21 nurse who can give them independent advice when they need it.
Bye, ladies. Bye. Okay, Mojo. All right, Mojo.